SAFE stands for Substance Abuse Free Environment, which serves the entire county of Chesterfield, Virginia. We have about 320,000 people. It's a large suburban county south of the city of Richmond. In 2010, our survey data was starting to show that we were having a significant problem with prescription drug abuse among the young people in Chesterfield County. However, the survey didn't contain a question about cough medicine abuse. So in 2012, we added a question to our survey, and then we were really shocked to learn that this was almost 3 times the national average for past 30-day use. In addressing cough medicine abuse, of course, your primary audience is your parents and other adults. One of the issues is that parents are not aware of this as a problem at all. At our middle and high school orientations, which are very well attended by parents, we provided a brochure on cough medicine abuse along with some information about the importance of locking up prescription drug medications to about 8,000 parents. But we decided to take a little more non-traditional approach in trying to reach parents. And actually this came kind of serendipitously in that someone brought back a receipt from their pharmacy and it read, "Preventing teen cough medicine abuse. You must be 18 years of age or older to purchase medicine that contains DXM." We wondered how easy is it actually to go to stores and buy the over-the-counter cough medications. And so we got together a group of about 5 teens and sent them out to major pharmacy chains, grocery stores, big box retailers, and also a few convenience stores. We found that out of the 22 stores that they visited, a little more than half of the stores they were able to actually purchase the medications. We followed this up by contacting the regional managers of these stores and congratulating the ones that had policies for taking a voluntary stand in helping to protect our young people.
Well, by chance you have your ID with you today?
But also noting that the policy wasn't always consistently enforced and encouraging them to talk to store managers and make sure that clerks were following the policy so that they were not selling to anyone who would come in under 18.
It's coming up not for sale.
May I ask why?
Because you're not 18 years of age. It's store policy, you have to be 18.
We were fortunate by doing this project to get some good media coverage. Our real coup was an article in the Chesterfield Monthly. This was able to reach a lot of parents in the community in a better way than anything else that we could have done. And of course, everything is pointed back to our website where you can find more information about cough medicine abuse, where to get help, and what to do if you think there's a problem. We developed a series of 4 summits where we divided into work groups to focus on different aspects of the issue, including community education, healthcare professional education, and proper disposal of medications.
In one of our very early forums, we realized the need to educate not only the lay public, but also our clinical providers and our prescribers.
The healthcare provider education work group actually put together 2 major trainings for healthcare providers.
We brought speakers well-versed in best practices to speak about common protocols they deploy before providing medications that could be potentially addictive.
Our community education work group decided to utilize the Medical Reserve Corps, our volunteer branch of the health department, to go out in their official shirts to physician's office to help get information out to the general community.
We're also holding, again, not only summits for the professionals, but we've had community summits. We paired this with messages at the same time through a media campaign that was funded by the Virginia Department of Health. So while we're going out into the community talking about locking up your medications and drug takebacks and inviting specific providers to these summits, our community, including the providers, were also hearing these messages through the TV, through radios, through ads. Hearing the message from multiple venues was really successful.
We really realized that we had a problem, and the way that as a coalition you solve problems is you bring people together who all have their own take on the problem, and you get them to start working together, thinking about what can we do to change things.
I knew that SAFE was holding their medication abuse summit, so I volunteered to go to that and be the representative from the Attorney General's office. We've been able to take what they've done on a local level, and we have the resources to take it to the state level, and that's what I'm trying to do with this statewide mentoring program, with the statewide lock boxes.
I got involved in the project because growing up, being exposed to certain things which I maybe shouldn't have been exposed to, I was able to turn my life around, and I have truly been trying to use my message, my life story, to impact and make a difference in the lives of those around me.